Welcome to the Revita Health and Wellness Show. I'm your host, Francine Marie, and we're with Dr. Lomanchar today. How you doing, Doc?
How you doing? Good.
I'm on the phone with my girlfriends, and I am trying to talk them off the ledge with this 500-calorie diet. And
Awful.
It's so hard to tell them to keep going. It's going to be okay.
Yeah. You know, it's a lot of practice. You know, they can use the 500 calories diet. They call full liquid diet. And to me, and again, I'm going now to blend internal medicine and bariatric practice as a physician, and I care about my patients, and I don't think 500 calories is a good diet. It's way too low in calories. A full liquid diet is not enough to fulfill all you need as a human. I believe more in a balanced diet. High protein, good carb, low fat, and exercise. So I go back to the lifestyle change. I have a lot of good stories about my patients. I had this lady, Miss Susan. She comes and she was so disappointed because she was in her late 40s and she has tried to lose weight so many times. Mm-hmm. And you know, you get pregnant, you gain weight, and you lose weight. And you get pregnant again, you gain weight, and you lose weight. So she did that for 2 or 3 times, and she was successful. But with the aging process and getting in her late 40s, your body is totally different, so will not respond as well as when you were 25. So at that particular time, we had some lab work done. Definitely thyroid is there, and her thyroid was normal. And so I asked her about her menses or menstrual periods and see if she maybe was menopause or perimenopause. Huh? And it was the case. I mean, she was having some irregularities and changes. So with some hormones, lab work and so forth, and we went into the menopause treatment. That definitely is the reason for a lot of females to be overweight and not be successful as they're trying to lose weight unless you get on the treatment for your menopause.
Right.
Where it's very easy, it's called bioidentical hormones, and like the name, they are very like human hormones, so the side effects are very, very low. The patients will tolerate the doses very, very well. I have a lot of patients taking bioidentical hormones and very successful on a lot of things, energy, weight loss, they sleep better, hot flashes, they go away. And I have this lady, not Miss Susan. Miss Susan did very well with the weight and the bioidentical, but I have another lady, she is Miss Margaret. And Miss Margaret came to me when she was like 65 years old. And she said, you know, I have exercised all my life. She's beautiful. She's a 65, you and I wanted to be like her. And she said, you know, I went through menopause, I did very well, and I kept my weight down, exercising, eating well, but now I'm 65, I just cannot do it anymore. And you know, it was hormones. So she went on hormones, and we talk about a different intake. I don't like to say diet.
Okay.
Because diet feels like you're going to do it for 5 days.
Right.
Or 5 months.
This is a lifestyle change.
It's a lifestyle change. You're going to change your intake. You're going to eat healthier. So she changed her intake, went back to her exercise and everything, and then went on the hormones, on the bioidentical hormones. And she is gorgeous.
Oh.
Miss Margaret had a very, very beautiful success as well. And she's now about 70. And she said she's not going to stop taking her hormones because it never had any side effects, and her life is beautiful.
So there is hope for us. There is hope because, you know, we go to the gym. We're in that period, you know, between the 40s and the 50s, and we're in the gym, and we might lose 3 pounds that month, and that is discouraging, but you are encouraging.
Oh, it's there. You can do it. Anybody can do it.
Bioidentical hormones.
Bioidentical hormones, lifestyle change, and eating healthier.
We like that. Yes, Dr. Lomanchar is with us today, and you're viewing Revita Health and Wellness Show. We'll be back.